DocSync mobile charge capture is done from the My Patient list. Begin by selecting a patient, tapping into the white space on the patient tile. The date of service is presented as a current date. Tap into the chevron on the diagnosis. Tap into the search bar to enter the first three letters or a commonly known abbreviation for the diagnosis that you're looking for. We're selecting hypertension, essential, and select when the blue description is presented. We're going to clear that out, and we're going to enter end-stage renal disease, ESRD, end-stage renal disease due to benign hypertension. Done. Close the diagnoses. Add a procedure code. We've got favorites listed here, so we're going to add a 99223 initial hospital care admission code. We're going to close that out. We've got quick list menu items that are customizable by your practice. So this is we're going to tell our billing department that we're the admitting doctor. We're going to say that this was referred by Dr. Josh Dobstaff. And this will pull from the CMS database. And then we're going to set our charge through. Our patient list is going to update, showing Mr. Harrison, changing him from red on our patient list to blue, indicating that we've submitted charges on him today. To round on a patient, we can select a patient on our list who's been seen by another provider or the same provider. Click in and edit the diagnosis or review them to make sure that they are still all appropriate from when the admission was done. Click on the procedure code, and we're going to add a follow-up visit. So we're going to enter a moderate level subsequent hospital visit. We're again going to be the admitting provider, so we can add that to communicate that to the billing office if we'd like to. And we're going to send the charge through. And that's how easy it is to submit a rounding code on a patient. Now, if we go back to Mr. Harrison, and we've submitted our charge on him, and he's gotten to be sicker as the days prolonged, rather than resubmit additional charges on him, we can go into our timeline. We can edit his charge, and we can say that we sent in an initial hospital care. Well, we want to add some critical care time because we went in and he got moved into the unit. We needed to add that, and we resubmit his bill. And we've updated his charge. Now, as you can see, we've got two different charges here with similar charges. And if I say, well, that didn't actually happen yesterday, I can delete that charge. If we've determined that we entered charges on the incorrect patient or we did duplicate patients, it's very easy to edit those by going to timeline and edit or delete a charge on a patient. We encourage new providers to monitor their patient charges by swiping all the way to the end to statistics. And here they can look at their daily charges, and they can look for duplicates, they can look for incomplete charges, and go back to their patient list, into their patient tile and timeline to edit anything that needs to be edited.